Hello everyone, welcome to my channel. In today's video, I'll be talking about a commonly used medication called Lisinopril. If you find this video helpful, don't forget to like the video and subscribe to my channel. What is Lisinopril and what is it used for? Lisinopril is a medication used to treat high blood pressure, hypertension, heart failure, and to reduce the risk of death after a heart attack. It may also be used for other medical conditions, as recommended by your healthcare provider. How does Lisinopril work? Lisinopril works by blocking the angiotensin-converting enzyme, ACE, which stops the production of a hormone called angiotensin-2. This hormone narrows blood vessels and raises blood pressure. With the effect of Lisinopril, blood vessels relax and blood flows more easily, which helps lower blood pressure and allows the heart to work more efficiently. Forms of Lisinopril. Lisinopril is available in tablet form or as an oral solution. It typically comes in doses ranging from 2.5 mg to 40 mg. Your healthcare provider will determine the most suitable dose for you. How to use Lisinopril. Lisinopril is usually taken once a day. You can take it either with or without food, but taking it at the same time each day can make it easier to remember and maintain a steady effect. Starting dose. For high blood pressure treatment, the typical starting dose is 10 mg. However, your doctor will decide the best dose for you. Timing. Try to take Lisinopril at the same time each day to help remember to take it regularly. With or without food. It can be taken on an empty stomach or with food. However, if you prefer taking it on an empty stomach but are concerned about stomach irritation, a light snack can be helpful. Missed dose. If you miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and take your normal dose at the usual time. Never take 2 doses at once. Fluid intake. It's important to drink plenty of fluids while on Lisinopril, as dehydration can increase the risk of side effects. Alcohol use. Alcohol may increase the side effects of Lisinopril, especially dizziness or fainting, so be cautious. Precautions before using Lisinopril. Before taking Lisinopril, make sure your healthcare provider knows if you have heart, kidney, or liver problems, have health conditions such as diabetes, are pregnant or planning to become pregnant. Lisinopril can interact with certain medications, so be cautious when combining it with potassium supplements, diuretics, water pills, or pain relievers like ibuprofen. Drug interactions. Lisinopril can interact with several medications, including other high blood pressure medications, heart failure medications, potassium supplements, non-steroidal anti-inflammatory drugs, NSAIDs. If you are taking any of these medications, be sure to consult your doctor. Common side effects of Lisinopril. Some common side effects of Lisinopril include headaches, dizziness, cough, low blood pressure, chest pain. If these side effects bother you, it's important to consult your doctor. However, there are also some serious side effects to be aware of. Thank you for watching my video. If you found this video helpful, please like the video and subscribe to my channel. See you in the next video.